NSAIDs can be associated with heart disease, with high blood pressure. I'm a kidney doctor, and I have placed many patients on dialysis because of NSAID nephropathy or NSAID kidney disease. So people must consult with their physicians, even if it's just an over-the-counter medication.
Welcome back. Every day, millions of Americans depend on a common type of medication known as NSAIDs to treat anything from a headache to arthritis to even a common cold. NSAIDs are a non-steroidal anti-inflammatory drug that you can get over the counter or through a prescription. These medicines include ibuprofen or aspirin, among other things. While there are many benefits to take these common painkillers, if you are not taking them correctly, you can end up doing more harm than good. And luckily, joining us now in the studio to talk about this and what you need to know about is Dr. Frita Fisher. You like to go by Dr. Frita, I'm told. So thank you so much for your time. I appreciate it.
Thank you.
So what do we need to know about these drugs and if they're not being used correctly?
Yes, Jay. So NSAIDs are wonderful drugs in that they can reduce pain, reduce inflammation, reduce fever. The problem is that just because so many of them are over the counter, people think that, hey, it's over the counter, it must be safe. But if they're not used appropriately, they can cause many, many harms and can even be fatal. NSAIDs can be associated with heart disease, with high blood pressure. I'm a kidney doctor, and I have placed many patients on dialysis because of NSAID nephropathy or NSAID kidney disease. So people must consult with their physicians, even if it's just an over-the-counter medications, to prevent some of the complications.
So those are some serious consequences here. So what are some misuses of it? Would it be like abusing the medication, for one?
Well, one would be if you're taking it and it's contraindicated. So if you have chronic kidney disease, then even if you're following the directions on the bottle, the NSAIDs are probably not for you. For my patients with advanced kidney disease, I say don't take it. Also, if you have pain and you take it and you keep taking it a little bit more than what you're supposed to, like the over-the-counters, ibuprofen, Motrin, and you think that it's okay, it could lead to bleeding stomach ulcers or bleeding other places in your gastrointestinal system. Also, if you're a pregnant lady, especially in the third trimester, NSAIDs are not recommended. And so there are all kinds of issues that can happen with the NSAIDs. You just must follow the directions and very specifically consult with your physician.
What situations would you recommend someone using these, and in what way, and say differently from something like an ibuprofen or a Tylenol, something like that?
Okay, so if you don't have a contraindication and you have a fever.
What's a contraindication?
A contraindication if there is a reason or a diagnosis you have that says that you should not take it. So kidney failure, liver disease, a pregnant woman in the third trimester, or if you're someone who is older and you've had a history of ulcers, then you should not be taking them unless it's under the advice of your physician. Or if you have heavy alcohol use, like if you're drinking more than 3 alcoholic beverages a day, that could increase your risk for stomach bleeding. So these are some of the contraindications, reasons that you should not take them. If you don't have any of those and you're a pretty healthy person, then you should take them for no more than 3 days to relieve fever, no more than 10 days for inflammation, unless your physician has specifically told you otherwise.
So this is really a conversation you need to have with your doctor or nurse practitioner about what would be the exact approach, how much to use them, would you say?
Absolutely. And I really think the main point is everything that's over the counter, it doesn't mean that it's totally safe. It's still a medication. It still has potential risks.
So for any viewer right now at home who is considering about using NSAIDs or NSAIDs? Am I getting it wrong?
NSAIDs.
NSAIDs.
Yes, yes.
NSAIDs, my apologies. Who is considering getting this prescribed, what would your advice to them be? What would be the bullet points?
The bullet points would be, number 1, consult with your physician. Number 2, think if you've had some of the complications already, like if you've ever had ulcers or if you have heavy alcohol use or if you're pregnant, just kind of pay attention. Are you one of these people? If you have heart disease, if you're a smoker, all of these things should be red flags that you may not be the person to take NSAIDs. And if you're not sure, talk with your physician, and certainly don't use them in a way that is not described in the directions.
Yeah, really important advice too, because considering you can get these over the counter, really easy to pick these things up like a bottle of Tylenol. So really important, and thank you for coming on, Dr. Frita. Appreciate it.
Thank you. My pleasure.
All right.